This program is brought to you by Stanford Hospital and Clinics.
Thanks for coming today to the Stanford Lymphedema Center. I know that you are a breast cancer survivor, and I know that you have some lingering concerns about preventing lymphedema, so I'm hoping you will pose your questions and see if we can give you some good answers.
Okay, well, I think I'll start just at the very basics about what exactly is lymphedema.
Well, lymphedema is the accumulation of a particular kind of fluid, typically in a part of the body. So in breast cancer, it will be in the part of the body that's affected by the lymph nodes that are removed as part of the cancer staging. So in this case, if the cancer is in one breast, it'll be the arm on the same side that is prone to the swelling. The lymphedema is the accumulation of fluid in the tissues that's otherwise destined to become lymph once it enters the lymph channels. So lymph fluid, or interstitial fluid as we would call it before it enters the lymph channel, is very high in protein, which is what the lymphatic system is required to transport, and then the water goes with it. So that's a very unique quality of that fluid and what sets apart lymphedema from other kinds of edema or swelling.
So you've sort of explained the lymph system and what it does, but why is it important to us?
So fluid is one part. It's a very important part, but I think many people don't realize that the lymph system is part of the circulation, and that's why it helps with all the protein and fluid movement. It's also part of the immune system, and it fulfills a function that we call immune trafficking. So all of us every day are bombarded by invaders, viruses, bacteria, that want to get into our system through the skin, because we all have millions of microscopic breaks in the skin. And it is the job of the lymph system to send the messages to the immune function to say, hey, there's an invader, send an army, we need to get rid of it. And when the lymph system is interrupted by surgery, for example, for breast cancer, it leaves that part of the body prone to infection, as an example, because the immune system is not able to undertake its usual form of surveillance.
So as a breast cancer survivor, what is my risk for getting lymphedema?
Well, the estimates vary, and fortunately things have been getting better all the time. Back in the day of Halsted, when the surgery was quite radical and quite brutal, he's the one that invented radical mastectomy for breast cancer, the incidence was about 50%, 1 out of 2 women who were treated for breast cancer. Now the estimates are, if you've had axillary lymph node dissection, which means lymph nodes have been taken out of the armpit region, more than 4 of them, the risk is about 15% on the low end. Estimates on the high end would be as high as 25%. So let's say somewhere between 1 in 4 and 1 out of 5 individuals who survive an axillary lymph node dissection may develop lymphedema over time.
And this is something I have to worry about my whole life?
I think you need to be vigilant about it. I hope the word worry is a stronger statement than we can convince you to use. You do have to think about it, but let me make one point, and that is the main risk for lymphedema development is in the first year, and I'm going to say 90% of the cases we'll see are going to happen during the first 12 months after the end of treatment, if that's surgery or surgery plus radiation. And beyond that, we're going to see about 95% of it in the first 3 years. So after 3 years, if you don't have it, it is a risk, but it's a very small risk. And if you take the proper precautions and use the proper surveillance, we hope we can keep that as minimal as possible.
So how does surgery affect my risk of lymphedema?
So again, it's mainly the lymph node removal. So individuals that have just lumpectomy or other surgical interventions are at very, very low risk, really almost not measurable. Risk is there, but in such small numbers we couldn't really estimate it. The next group will be sentinel node patients, and that represents these days about 40% of the breast cancer surgical population will finish their treatment with sentinel node and nothing more. We define sentinel node as the removal of less than 4 lymph nodes. And provided that's the case, the risk is about 6%. So just about what it is for a late survivor of a more aggressive surgery. If you have more than 4 lymph nodes removed, then it goes up to that 15 to 25%, and probably a little worse if you have that much surgery plus radiation, or let's say radiation by itself with or coupled with the sentinel node approach is about equivalent to what surgery is.
So is there a risk for lymphedema if you've had no lymph nodes removed but have had either a lumpectomy or mastectomy?
There is a risk. It's quite small. As I say, then I think the numbers there are so small as to be not measurable, but not zero.
Not zero, okay. So if I've only had one lymph node removed from under my arm, do I have to worry about lymph node in other areas of my body?
So in the case of breast cancer, the lymph node spread is quite regional. And one of the reasons we use the sentinel node technique is that it's like an army advancing in a way. So if the first tier of lymph nodes that are removed are negative, the risk of other lymph nodes being involved is very, very small. Beyond that, I think I should emphasize that if you have lymphedema or lymphedema risk regionally in one part of your body, because lymph nodes have been removed in that part of the body, all of the tissues that drain into that part of the body are potentially to be affected. So it can be the arm, it can be the breast, it can be the shoulder region, or maybe over the back of that side, but not remote parts of your body. So you have a lymph system everywhere, but your other arm is okay, your legs are okay, your face is okay, your neck is okay. It's really just the region that was operated on or treated by radiation.
Okay, so my next question was going to be about radiation treatment affecting the development of lymphedema. So
radiation can traumatize the lymph system equivalently to surgery, even if surgery is not done. But we know that not all radiation is alike, just like not all surgery is alike. There are degrees of radiation. So in part, it's dependent on the total dose of radiation. In part, it's dependent on where the radiation is directed. So it's particularly worrisome for the question of lymphedema if in the radiation field is included the armpit region itself, and the breast itself is going to increase to some degree the amount of concern that we have for the development of lymphedema. And the surgical risk and the radiation risk are superimposable and I think to a degree additive. So obviously somebody who's had an axillary lymph node technique and then has adjuvant radiotherapy on top of it, needs to be a little more vigilant because the risk is probably a little bit higher.
So my next question was going to be if I was still at risk if I only had lymph nodes removed and not radiation, but it sounds like it's true.
Either or
and both.
Correct.
Right.
Correct.
So I have a question about exercise and how long I should wait after surgery to exercise.
It's a very good question. I think that we can learn a lot from the differences in the American versus the European experience to breast cancer surgery. As you may or may not know, in Europe, women go into the hospital for a mastectomy or some surgical technique for breast cancer, and typically they stay a week. And they're encouraged to be very inactive during that first week in terms of use of the arm. They don't get dressed, they don't put on a bra, they don't put on a blouse, they don't start their exercises. And I think they see much less in the way of postoperative fluid problems compared to the United States, where we've gone to a system, unfortunately, where because of cost of healthcare and so on, typically a woman stays 23 hours in the hospital. It's an overnight stay. By the next morning, she's got to put on a bra, put on a blouse, start going on with life. And I think we see more problems with postoperative fluid accumulation. Sometimes that's called a seroma, where a pocket of fluid will develop around the breast or in the armpit region. And I think there's some tangential relationship to the risk of lymphedema. So I'm going to extrapolate from all of that and say this is not well studied. But I believe that while exercise in the long run is very beneficial, I believe it's very important to give your body adequate time for healing and not push the exercise early on, which is not to say that patients shouldn't be very active at mobilizing the shoulder, making sure there's good mobility, because women are also prone to frozen shoulder after mastectomy, but not push the physical activity until the body's ready to do it. So I think the first 3 to 4 weeks are really pretty important to stay on the inactive side, and thereafter to try to progressively get more active.
So if you're going through 6 weeks of radiation, what about exercising during radiation therapy?
I think similar concerns. I think there's going to be enough inflammation surrounding the radiation that you don't want to overtax the lymphatic system. So I would take it easy during that time as well.
So should I be using my arm normally for everyday activities?
My answer is absolutely yes. With a couple of codicils to that recommendation, which is that I think everyday activities are fine, but bearing in mind that the more weight that has to be lifted in those everyday activities, the more physically stressful it is, the more you're asking your body to provide blood flow to your arm that's at risk. And blood flow equals increased fluid filtration. And if the lymph system is compromised but hanging on, you don't want to push it over the edge. That's why I think once you recognize where the threshold is, where you're really beginning to tax your body, I say do those things, but get fitted for a compression garment, a class 1, just a simple preventive sleeve that will keep the fluid accumulation from being a problem during, for example, weight training, or if you do rowing, or if you do rock climbing, or whatever it is that's part of your more strenuous day-to-day life. I encourage you to do it, but do it with some care.
And that's lifelong?
Well, I think the risk is most important during the first 3 years, as we've said, and thereafter, like so many things, there's a bit of trial and error involved. It also depends on the way you approach life. Some people are more risk takers than others. If you don't want to be a risk taker, it's lifelong. If you are willing to introduce an element of risk as a late survivor, I think it's reasonable to begin phasing some of those things out and figure out when you need them.
Okay. Is there any time that you recommend a patient seeing a physical therapist if they think they're, getting lymphedema?
So I think a physical therapy interaction in the absence of an interposed physician or healthcare provider is probably not appropriate for the diagnosis end of things. If, on the other hand, as a patient, you're interested in being proactive in preventing lymphedema, I think it's perfectly acceptable for a physical therapist to see you for 1 or 2 or 3 sessions to teach you some self-care techniques, which would be the same things that a lymphedema-affected patient would do, but in smaller quantities. And learning those techniques and learning when to do it and what to do is a very good way to use the resources of a therapist.
Okay. So as cancer patients, once a cancer patient, always a cancer patient, we seem to have to go for our checkups, which include a lot of blood draws. So should we or should we not have blood drawn on the arm where we've had lymph nodes removed?
This is one of those situations where I'd like to say never, but there are almost no nevers in medicine. So I'm going to say as close to never as possible.
Okay.
If there's any way to do blood draws or IVs or any other puncture of the skin while avoiding the arm that's at risk, that is definitely preferable. However, I want to recognize that the risk even there is pretty small. It's not zero, but it's small. I've definitely seen patients who've had the onset of lymphedema after a blood draw or after another intervention, but it happens rarely. On the other hand, there are life-threatening and life-saving situations where you need an IV in that arm, or you need somebody to do something to that arm, or you need a surgery on that arm. And by all means, you have to factor that in. I would not prevent a physician from doing something that they absolutely need to do in your affected arm. You just need to look them squarely in the eye and say, are you aware of the fact that I'm not supposed to have blood drawn from that arm? And if they can give you a cogent reason why they need to, then let them do it.
And I assume the same for vaccinations?
Same. Anything that punctures the skin. Okay.
And what about acupuncture?
Same for acupuncture. Now, there may be some benefit to acupuncture in either preventing or treating lymphedema. I'm not an expert, and I don't know what Eastern medicine has learned about this. The only caution I give my patients is it's fine to have acupuncture, just not in that arm. Anywhere else in the body is fine, not in that arm.
A lot of people these days are getting tattoos. What do you feel? How do you feel about those?
That's a never.
That's a never.
On that arm, that's a never.
Okay. What about having blood pressure taken on the
That's the
arm?
almost never.
That's the
That's the
almost.
almost never. So we prefer that it not be done. The place that I've seen it pose the most risk, and not an individual blood pressure in the doctor's office so much, but when patients go into surgery, very often a blood pressure cuff will be put in place and left in place and inflated and deflated at very frequent intervals for a 2 or 3 hour surgery. I've seen lymphedema develop in that circumstance. So it's very important that the doctor, the anesthesiologist, the nurses, everybody be told, big label across your chest when you go in, don't put the blood pressure cuff on my right arm, my left arm, whatever it is.
So that brings up women who've had, bilateral mastectomies and auxiliary node dissections on both sides. What do they do?
Well, the recommendation is, and the cautious approach would be to do everything in the legs. You can take a blood pressure in the leg. The nurse never likes to do it because it's a lot more work. You have to take your slacks off, et cetera, et cetera. But it can be done, and it's an adequate approach. You can draw blood from the leg as well, although again, it's more laborious, and not every laboratory is prepared to do it. If you've had bilateral interventions that put both limbs at risk and you're concerned about lymphedema, you should insist wherever possible that be the approach that's taken. Once again, if it's life-threatening, if it's urgent, if there's a time element, if there's a reason that somebody can tell you that they don't want to do it in the leg, you have to take that under advisement as well.
So should I panic if I get a cut, a scratch, or an insect bite on my arm?
Definitely not. Definitely do not panic. That is not to say that those things couldn't be the incipient event, but very low frequency of that. The important thing to do is, number one, if there's a break in your skin, wash it well. Put on a local disinfectant, the type that you can buy in the drugstore, whether it's an iodine solution, whether it's a Neosporin ointment, something to locally disinfect the region, and watch it carefully. At any sign of any swelling, even modest, of that arm, or any sign of red streaks or advancing infection, run, don't walk to your doctor, to the emergency room somewhere, because we want to treat the infection as quickly as possible. And if we notice new swelling, we want to get on it as quickly as possible because it may be reversible. Again, I want to emphasize, don't panic, because the likelihood of any of that stuff happening is really, really low. Just be vigilant.
Okay. So should I wear protective gloves doing housework and garden work?
Always a good idea when it's reasonable and feasible. Anything that's likely to either cause a local burn or a local break in the skin is better to be avoided. So kitchen gloves when you're doing things that are going to abrade the skin. Oven mitts when you're taking things in and out of the oven. Garden gloves that are heavy if you're pruning rose bushes. Those are all prudent. And I think are things that normal people do too. So it shouldn't feel like as much of an imposition as what the lymphedema patient has to feel like when they have to wear a garment every day. This is really part of daily living, but it's cautious daily living, and I think it's appropriate.
Cautious daily living, yeah. So do I need to worry about sunburn?
Absolutely. Any breast cancer survivor who goes out in the morning should have sunblock at least on the affected limb. Now, we all should be worrying about melanoma, so we should be wearing it all over our exposed skin, but sunburn is one of the things that can trigger lymphedema. So sunblock is an always measure.
Yeah. So what about sewing? Do you recommend a thimble?
Sure. That's,
You're gonna
again,
puncture?
I don't sew, but I'm assuming that's common practice by some people who do. And I think avoiding that needle going into your thumb is probably a great idea.
So speaking of sunburns and heat, what about hot tubs and saunas?
Hot tubs are okay. Again, heat will increase blood flow to the skin, so there is some implicit concern. My basic advice is if you can get into a device, a hot tub or a sauna, where the temperature stays below 105, I think you're okay. Those extreme temperatures, maybe sauna is not such a great idea because I know they go quite a lot higher. But a hot tub is fine as long as it's not too hot. Just like you can get in the bathtub, and the water can be pretty warm.
Okay. Is just regular massage a risk for lymphedema if that massage therapist is too rough or?
I think a small risk. I think that I'm not keen on shiatsu and deep acupressure massage because there you are actually traumatizing the skin and you're asking the lymphatic system to respond. I think the more typical athletic massage or Swedish massage, those are all fine, provided that everybody understand that those massages will not help lymphedema.
Right.
They won't prevent it, they won't treat it. But if they feel good, I mean, they do increase blood flow to the skin, so you need to know that. I think they're safe, but not the deep acupressure.
So should you mention it to your massage therapist that you're at risk?
Absolutely.
Okay.
Not all massage therapists are necessarily that knowledgeable about lymphedema, but it's certainly worth mentioning.
Okay. So how important is weight control for lymphedema?
Very important. When we look at the group of people who develop lymphedema after breast cancer, for example, versus those that have similar surgeries, similar radiation, but don't develop lymphedema, one of the big distinguishing features of the lymphedema group is they tend to be more overweight. So it appears to be an independent systemic risk factor once you've had all the other things in the mix, like the surgery and the radiation therapy. So keeping weight under control, preventing weight gain, preventing obesity will really help to limit the risk of lymphedema.
So then I assume exercise helps.
Exercise helps. And unfortunately, some of the hormonal treatments for the cancer encourage weight gain. We know that. Sometimes it's not in anybody's ability to control. But everything that you can do to watch diet and maximize physical exercise is going to be to the good.
Now, I've been told by doctors that I'm at risk if I lift heavy weights over my head. So is there any exercises I should avoid?
In principle, I don't think anything is impossible. I think even weight lifting above the shoulder is fine with two provisos. Certainly in that scenario, which in principle is somewhat more risky, I would wear a preventive garment during the exercise. Number two is you need to work up to your maximal exercise threshold. You don't want to start with a 100-pound weight over your head. Start with 10 pounds or 5 pounds, something that you can do easily with many repetitions. But if your goal is to get to more weight and less repetitions, do so in a gradual fashion so that day by day you can gauge your body's response. Take 2 or 3 weeks to get to the point you want to get to. Because once you've exceeded it, then it may be too late. But if you edge up to it, you'll know how far you can go.
I've been told by my doctor, because I had reconstruction surgery, not to take antibiotics before dental work. So would that also apply for the risk of lymphedema?
Not lymphedema itself. For the reconstruction, if there's an implanted device, there is this concern that if bacteria get in the bloodstream that they can seed the device and infect it directly. For the lymphedema, the bacteria get in through the skin, not through the blood. And so you don't really need to worry about that.
So is smoking a risk factor for lymphedema?
No, it's just bad for you.
Bad.
Just don't do it.
Just don't do it.
I'm a cardiologist, I have to say that.
Is there any reason to keep an eye on the measurement of your arm at home?
I strongly discourage that for the simple reason that I'm a big believer in wellness. And I think wellness, part of it means emphasizing your wellness, which means de-emphasizing your non-wellness. And anything that you're doing in a routine surveillance manner, particularly if you're measuring things, marks you as not well.
Right.
And I don't think the gain from that is very great anyway. I would encourage people to take the proper steps, know what they have to do, and put everything else aside and try to think about this as little as possible.
So as someone who's at risk for lymphedema, should I get a compression sleeve? And if I do, when should I wear it?
Now I have to go to the side of things that we call non-evidence-based medicine because nobody has studied this. What we do know are the things that I've said to you, that exercise increases blood flow, therefore filtration, therefore the risk of lymphedema. So we think that wearing a garment to limit that should make exercise more safe. The other area in which we tend to see lymphedema being provoked is airline travel. We know that the commercial airlines are somewhat depressurized and they encourage lymphedema to appear in somebody who might be at risk. So we think, but don't know, that wearing a garment during air travel is advisable. I think it makes sense, but it hasn't been studied. However, I'm enough of a believer in it that I recommend it. So I do recommend that any patient that's concerned about lymphedema and is at risk be fitted for what's called a Class 1 garment that's less pressure than a typical lymphedema treatment garment would be, that it be worn certainly during airline travel, during any protracted stay at high altitude, more than 5,000 feet, which is equivalent to being in the plane,
Yeah.
and during vigorous exercise when we think there might be a risk of triggering lymphedema.
Okay.
Again, I cannot tell you that I know data that it works, but if somebody's motivated to be a little more aggressive, that would be the thing I would
Okay.
recommend.
So what are the signs of lymphedema? And how can I tell if I'm getting lymphedema?
It's swelling and discomfort. So if you know you're at risk, you know your medical history, you know you've had the right kind of surgery, you've had radiation, whatever the case may be, you know the part of the body that's at risk. If you notice a gradual tendency for that limb to feel heavy or achy or funny, if it looks bigger, if it feels bigger, you're going to know before anybody else around you will ever notice. Those are early signs. They don't have to be, but they can be. And that's enough of a trigger to go to a healthcare professional and say, I feel X, can you examine me? Can you reassure me? What's going on? Is this lymphedema?
Yeah.
It very often may not be. For every patient who comes in with that kind of complaint of very subtle early things that proves to be lymphedema, I see 3 or 4 who are at risk, but it turns out not to be. So no reason to panic. That's my watchword, but it is reason to take a look at it and see what's going on.
Great. Well, thank you for answering my questions.
Thank you. Thank you for asking them.
Yeah.